When your baby or child is unwell, it is a really worrying time. Sometimes it can be hard to know what to do, but it's important to trust your instincts and get the right help. Strep A is a common type of bacteria that is found on the skin and in the throat. Most Strep A infections are mild and easily treated. Scarlet fever is caused by Strep A. It is usually a mild illness that is highly infectious. It causes a distinctive pink-red rash and flu-like symptoms and is treated with antibiotics. It's important that babies and children with scarlet fever are seen by a healthcare professional in their GP practice so that they can be started on antibiotics. Rarely, Group A strep can cause serious problems and spread to other areas of the body. This is called invasive Strep A, which can cause serious complications like sepsis and pneumonia that need urgent treatment in hospital. It is important for you to know what to look out for, where to get help, and when. The first symptoms to look for in your baby or child are the red symptoms. Skin is pale, mottled, and feels abnormally cold to touch. Blue lips. Too breathless to talk or eat or drink. Has a fit or seizure. Extremely agitated, crying inconsolably despite distraction. Confused or very lethargic, difficult to wake. Dark green vomit. Rash that does not disappear when you put pressure on it or use the glass test. Under 3 months of age with a temperature of 38 degrees C or above. If you notice any of these red symptoms, then get urgent help, either through your nearest emergency department or by phoning 999. The next symptoms to look for in your baby or child are the amber symptoms. Finding it hard to breathe, laboured or rapid breathing, drawing in the muscles below their lower ribs at their neck or between their ribs, recession. Unable to swallow saliva, dehydrated, sunken eyes, or not passed urine for 12 hours. Drowsy, excessively sleepy, or irritable, unable to settle them with toys, TV, food, or picking up. Especially if they remain drowsy or irritable despite their fever coming down. Has a painful red swollen gland in their neck which is getting bigger, or a painful swelling behind their ear that is pushing their ear forwards. Has a fever of 38 degrees C or above for more than 5 days. Has recently had scarlet fever but now has a puffy face or eyelids, Coca-Cola coloured urine or swollen, painful joints. Has the scarlet fever rash. The redness may be harder to see on brown and black skin. 3 to 6 months old with a temperature of 39 degrees C or above. Please remember a temperature is common in the 2 days following vaccinations. For amber symptoms, you do not need to take your child to hospital. We advise that you get help on the day they start, so you should call your GP or 111. Remember to recheck your baby or child for red symptoms if amber symptoms continue for 4 hours or more and you have not been able to speak to a healthcare professional or GP. If your baby or child does not have any red or amber symptoms, care for them at home. Keep an eye on them day and night and try to keep them as comfortable as possible. Consider giving paracetamol for comfort. Paracetamol can be given to children aged 2 months or older for pain or fever. Offer them simple food and regular drinks. Where a baby is breastfed, continue breastfeeding. If they are vomiting, offer small frequent drinks as this is more likely to stay down. Do not try to control your child's temperature with tepid sponging or fans. If red or amber symptoms appear, follow the advice for these symptoms. If you are worried, contact your pharmacist, health visitor, call 111 or contact your GP for advice. More information on what to look out for and where to get help if your child is unwell is available on the Healthier Together app. Download it today using App Store or Google Play or the Healthier Together website www.what0-18.nhs.uk.